It's been more than a month since the spending and tax plan known as the President's Big Beautiful Bill was passed, and Alabama's healthcare industry says they're still figuring out how exactly it could impact their ability to cover the needs of Alabamians. Gray Media political correspondent Jessica Umbro sat down with the president of the Alabama Hospital Association. And Jessica, what seems to be the confusion?
Well, President and CEO of the Alabama Hospital Association, Dane Howard, said they're working to determine just what federal regulations and assistance will be provided under this new legislation. Howard says they're optimistic about what the bill could mean for their industry, but there are some questions that just don't have answers to yet.
We're not really losing anything. We're kind of at status quo, frozen at status quo. What we did perhaps lose, or that's what we're waiting to find out, are the flexibilities that we had before to do a little bit better.
Howard says the Alabama Hospital Association was working on a plan to help address coverage gaps for Alabamians when the Big Beautiful Bill was passed. However, she said that plan depended on federal initiatives that are no longer available. The bill does have a section, the Rural Health Transformation Program, that sets aside $50 billion over 5 years to offset rural health care losses from other parts of the bill. As of now, Howard says they don't know the exact impact of those funds on Alabama. She says Alabama hospitals have the lowest reimbursement in the nation from all payer sources, from Medicaid to Medicare to commercial insurance.
You can't continue, as your costs go up, to continue to receive the same or the lowest reimbursement and expect to be able to maintain it.
There have been other states that have expressed concerns about having to close rural hospitals. Is that something that you all are looking at right now?
Well, that's always been a threat, and I don't want to say that we're going to have a number of hospitals closed, because sometimes that might be oversaid.
But Howard says Alabama hospitals have been struggling since before the COVID-19 pandemic, and they need to utilize resources better, pay providers better, or else hospitals will need to start eliminating services and potentially close.
We're doing everything we can to prevent those closures. That's pulling rabbits out of hats.
And Alabama is just one of a handful of states who did not expand Medicaid under the Affordable Care Act. So that kept assistance more narrowly focused compared to states who broadened that coverage with incomes of up to nearly 140% of the federal poverty level. As a result, Howard says they don't foresee losing coverage from the bill's expansion-related policies.
All right, thanks a lot, Jessica. Howard also says the Alabama Hospital Association was in contact with Alabama's congressional delegation throughout the process of writing up and passing the Big Beautiful Bill. She says some concerns that the AHA raised were taken into consideration when finalizing that bill.